Hi, I'm Dr. Kian, and today I want to use eczema and allergies as an example to illustrate why it's important to treat the root cause of a health problem and not just symptoms. I think more people are understanding why treating the cause is important because symptoms are a way to get your attention. When the body is out of balance, symptoms arise and they need to be respected and to listen to rather than be suppressed. And unfortunately in conventional medicine, certain therapies suppress symptoms, and eczema is a good example of that because steroid creams are what is used to suppress the symptoms of eczema. And you know, it's understandable, I think, when eczema symptoms come and there's this rash, it's itchy and it's uncomfortable and maybe it's in a site that's visible, we definitely want to get rid of it. But unfortunately, when the steroids, when we stop using them, the symptoms come back. So that's an indication that the root cause hasn't been addressed. When we do address the root cause, it does lead to a more permanent healing. So let's talk about what are the most common causes of eczema. There's definitely a genetic susceptibility to both eczema and allergies, but environment does play a big role. And this is what we call, there's a term called the total load, and you can picture a bucket where there are multiple factors that when they kind of fill up and overload the barrel, then symptoms start to arise. So what are those particular factors? It could be things like continual exposure to chemicals. It could be allergens like certain foods or environmental allergens. It could be a weak immune system or exposure to alcohol, smoking, stress. Mental emotional stress can really overwhelm the body. So when all these factors overload the body, then we have symptoms that arise. So part of the treatment of eczema and allergies involves reduction of the total load so that the body has the chance to be able to heal. And a big one that's helpful is food allergies, and I think we're becoming more aware of the most common food sensitivities, which is eggs, gluten, dairy, corn, it could be soy, it could be peanuts, all of that we want to address. So one of the big reasons people come in to see me is for identification of food sensitivities, and it's a little bit different than doing a skin prick where you know, the doctor goes and kind of injects the common food allergens into the skin and you get a reaction. That is a different component of the immune system called IgE, whereas the delayed one is called IgG. That's the one that gets missed a lot. There are a couple ways to test for that. One is a specialty lab that you can ask at this clinic. It's a finger stick test. You basically draw a little bit of blood and submit it to the specialty lab, and they check you for 96 foods, and you get an idea of which foods your immune system is sensitive to. Another way is what we call the Elimination Challenge. You basically go 2 weeks of avoiding the most suspicious foods, and if your symptoms are better, your allergies are less, the eczema starts to clean up, then you know that there's something about those foods that you took out of your diet that's responsible for triggering those allergies. So then we basically add the food back one at a time every 2 to 3 days, and we see if the eczema gets worse, then there's something about that particular food and we want to keep it out of the body. So that's actually the gold standard. The Elimination Challenge is what we call it, but I find that food allergy test extremely helpful to take the guesswork away and test you for 96 foods. Another really big one is to keep chemicals out of your household. So basically, you know, get rid of mold, get rid of dust, use hypoallergenic products. There's a really great website called EWG.org. It stands for Environmental Working Group. We'll put that site down. You can take a look at it, and it gives you a lot of good resources about avoiding pesticide foods, avoiding chemicals in common household ingredients. So really resourceful. Lastly, I want to mention a really helpful treatment called classical homeopathy that I find extremely helpful, especially in children, but also adults, in terms of clearing the eczema. So once we remove the food allergies and use classical homeopathy, it's really effective at treating the root cause and making it more of a permanent solution. With classical homeopathy, it's about finding the right remedy that matches the constitutional element of that person, the essence of that person. And so there's A lot of questions that are asked, the visits long and extensive, it's about maybe an hour and a half to 2 hours to ask the right questions about the overall health of the person. It's very holistic, and once we find the right homeopathic treatment, the right remedy, then it stimulates the body to heal itself permanently. So what I love about homeopathy is it's safe, it's effective, it could be used for babies, could be used for during pregnancy, breastfeeding, doesn't interact with medications, so it's a very, very effective and helpful therapy. So if you have other questions, you can contact the office and we can go over that some more.